And turning again to some health headlines, as February is National Cancer Prevention Month. And according to DHEC, 1 out of 2 men and 1 out of 3 women here in the U.S. will have cancer in his or her lifetime.
Now, these stats can be overwhelming and sometimes scary. So we've talked about some causes of cancer, and now it's time to talk about prevention. The thing we want to do is really educate folks to make them feel a little bit more comforted. So this morning, we are continuing the conversation with Dr. Christian Baker from Prisma Health, who is a hometown doctor from right here in the Midlands.
That's right, born and raised.
Yes, sir. All right, so let's get to our first question. We're going to pop that up on the screen. This is Olivia, who says, I'm so glad you guys are talking about this. Thank you, Olivia. She says, can exercising decrease your risk of cancer? If so, how much exercise is recommended?
Absolutely. That is a great question, Olivia. So exercise can lower your risk in addition to just a myriad of health benefits. So we say about 150 minutes of exercise a week. So if you average that out, it's about a half hour on 5 days a week. So try for that.
All right, let's see if we have another question here for the doctor. Can you tell through a blood test if you have cancer?
There are some tests that we do through the blood, namely the PSA for prostate cancer screening. That is a blood-based test. Most cancers, though, are what you've heard of with mammograms and colonoscopies. But, I mean, the way genetics is going, we will probably see some genetic-based testing for cancers in the future.
Oh, wow. Okay, it will be good to see that. Now, another viewer question we have here. This is Tanisha from Irma, who says, how often should you get genetic testing for hereditary cancer to see if any of the cancerous genes are active?
Absolutely. So a good way to look at that is if you have multiple family members with the same type of cancer, that is an indication that it's probably in your best interest to do the genetic screenings for things like the BRCA gene, which is probably the most heard of. But yeah, if you have multiple cancers of the same type, or even individuals in your family with multiple different types of cancer.
And we talked about, the importance of working out, of being active. What about, our food intake? What about our diet?
Absolutely. So clean eating is advised, lean meats in particular. So stay away from the red meats. And then pack it with fruits and vegetables, and that'll be the best you can do.
That's good to know, but I love a steak. Another question, I want to speak to breast cancer specifically. I've heard different ages that women should start really going to get checked for breast cancer. I've heard 30, I've heard 35, I've heard 40. Can you speak to that?
Absolutely. And I think some of the confusion comes from multiple screening organizations out there having their own sets of guidelines. But you follow starting at age 40 unless you have a significant cancer risk for breast cancer in your family. So plan for 40, but if there's a lot of breast cancer in the family, let's move that up a little earlier.
All right. Well, Dr. Baker, thank you so much for being here with us this morning
Appreciate
as we
you having
continue
me.
this important conversation. And don't forget, on the 19th of every month, we make sure that we do our buddy call here at WLTX. All right. Thank you, Dr. Baker.
Thank you all so much for having me.
Yes, we
Means a lot.
appreciate you.